In the 80s and 90s, we saw an increase in campaigns for the awareness of HIV and AIDS. The devastating loss of celebrities such as Freddie Mercury further highlighted the issue. Recently, the publicity has diminished, and the general population has become less at the forefront of considering this in terms of communicable diseases. Despite disappearing from the limelight, it has not been dismissed by Public Health or the Brunswick Centre, and today I'm joined by Anne from the Brunswick Centre and Alison from Public Health, who are here to share why awareness of this subject needs emphasising. Welcome to the show, ladies.
Thank you. Thank you.
Can you tell me a little bit about the services that the Brunswick Centre offers?
I can. We have a support service. They support people that's living with HIV and the families, partners, children and families. They do one-to-one work needs assessments, provide information and advice, support people around the medication and appointments. There's a hardship fund. They've got access to a dietitian, counselling service, alternative therapies. So lots of things on offer there. There's also a formula milk project that goes on, so that's around supporting mothers with HIV not to breastfeed the babies. We've got included in the staff from the support service, some of them are trained up around smoking cessation, so we can offer smoking cessation. We've also got a new project in Kirklees which is called Youth Out, so that's supporting young LGBT people from 11 to 24. Around the sexuality, sexual orientation, supporting the young people themselves, the families, carers, anybody that's involved with them. And then there's prevention, that's what I do. So that's reaching out to people. So I go out to various venues across Kirklees, encouraging people to test, giving information and advice around sexual health and HIV. We provide condoms, we provide lots of information, to be honest.
So in terms of the relevance to the Kirklees area, how much of a problem is HIV and AIDS around here?
Well, the figures say that the prevalence of HIV in Kirklees is not too bad, actually. So, but the problem with those figures are that nationally we know that approximately 16,000 people are living right now with HIV and they don't know.
Okay.
So I think it's probably important that we don't just look at the prevalence of HIV and assume that there isn't a problem because of that.
Yeah. And I guess if people are living with it and they're not aware, obviously that is going to be exponential in the prevalence then, isn't it?
Absolutely.
They won't know that
absolutely. And it's absolutely vital that people, take prevention measures to ensure that they don't contract HIV in the first place, but vital that people get themselves tested if they do think they've been exposed to HIV, because that early diagnosis is crucial. And if someone's diagnosed early enough, then because of the medications that are available to them now, there's no reason why that person cannot live as long and as healthy a life as someone that's not HIV positive.
Yeah. So in terms of the people in this area that would be most likely to need the testing, who would we be looking at focusing on?
Well, everybody's at risk of HIV.
Okay.
If you're sexually active, you're at risk of HIV. People don't know the partner's history. So we encourage everybody to get tested.
And how often would you recommend that?
As a guideline, annually.
Okay.
But if somebody thinks they're more at risk, then every 6 months we sort of recommend.
Okay, and would they come to you for that?
They can come to us, they can go to the sexual health service, they can go to community venues, I do outreach to different venues, they can get home testing kits from HIV Prevention England and from Sexual Health as well. So if people don't want to go out and have a test, they can do a home test.
And once they've had that test, what happens then? Say it comes back as a positive, what happens?
Right, well, we've got clear pathways, referral pathways. So if I'm doing a test and it's positive, we've got those things in place to be able to contact Sexual Health and get somebody seen as soon as possible.
Okay.
Get an appointment for them,
And the thing to reiterate is the fact that there are some fantastic support mechanisms out there for people that are diagnosed as HIV positive. So, they would not be left alone to deal with this.
Absolutely not.
As we mentioned, it's important that people are diagnosed early.
Yeah.
and most late diagnoses, and they're the ones that the prognosis can often be more difficult and more complex, and most late diagnoses are amongst the heterosexual population. So it's really crucial that everyone realises that they're at risk if they're having unprotected sex.
Do you think part of the reason why people don't come forward for testing is because of the stigma?
That's one of the reasons. There's lots of reasons why people don't come forward for testing. I think one is absolutely stigma.
Yeah.
Another is people are afraid of the test itself. They're not sure what the test is.
Okay.
People are afraid of the results. Some people are afraid around confidentiality issues. Well, will it be on my medical records? So there's lots of reasons why people don't come forward and test.
What does the test involve?
Right, well, the test that we do, we do a rapid, confidential and free HIV test, and it's just a little finger prick.
Okay.
And the results are there in 5 minutes.
So a little bit like if you've got diabetes and you're testing your blood?
Absolutely, it's exactly that.
Okay.
Yeah, and if somebody comes in for a test, we'll have a chat with them beforehand about why they think they want a test, or if they've got any worries. You know, we go through things. We'll go through sexual health, hepatitis, HIV. We'll give them advice and support, offer condoms and offer other services.
I understand there's some national campaigns that
That's
are going
right.
on to raise awareness. Can you tell me a little bit about
Yeah,
those?
next week it's HIV Prevention England. It's a national campaign called It Starts With Me.
Okay.
And the strapline this year is Give HIV the Finger. Which that's through the testing with the finger prick, yeah. So we're quite involved with that. We're a local activation partner with HIV Prevention England. So that gives us, you know, we've got access to resources and part of that national campaign.
And so have you got any celebrities or well-known people that are going to take part in that?
Well, we've got on next Friday, we've got 2 MPs from Kirklees that are testing, and that's part of a national campaign. So that's MPs across the UK that are taking part. So, you know, that'll bring publicity as well.
Excellent.
Yeah.
So, I mean, I heard recently that Sam Smith has come out that he's contracted HIV. Does that kind of thing help people become less, afraid to come forwards?
Getting rid of that stigma, because it's the stigma, you know, being HIV positive is not a huge problem anymore. You know, there's, like you were saying, Alison, medication, normal life expectancy, you know, people becoming undetectable, you know, which means they don't pass the virus on.
Okay.
It's that stigma. It's huge, and, you know, that really impacts on people's mental health, everything. It has a huge impact.
Absolutely, I'd reiterate all of those points. We do need to get over the stigma that exists within society, and HIV, when diagnosed earlier, is considered to be a long-term condition, and actually many clinicians consider it to be less complex than type 2 diabetes, for instance, which we just accept as something that's going on within the general population. The bottom line is having sex is not a crime. We've got to stop treating these people as if they've done something wrong.
Yeah. So if people want to get in touch with either of your...
Yeah.
How would they go about that? Is it an email or...?
Various ways. They can go on our website, which is the brunswickcentre.org.uk. Everything's on there. There's all staff's contact mobile numbers, office numbers, email, if people want to contact by email, and it can be anonymous. People don't have to give the names, and, you know, it's strictly confidential. We also use social media apps, and people, you know, we reach out to people through that as well.
And is that similar for yourself, or is there no direct contact with your...
We, in public health, we commission services, so we rely on the fantastic
so the contact
services
would
that
be
are out
entirely
there.
through the Brunswick Centre. Well, thank you so much for coming in and talking to us today.
Very welcome.
Thank you.
I do think it's a subject that needs highlighting,
Absolutely.
for sure. And I hope that this goes some way to help it. I'm Emma Kirk. Goodbye for now.